So I often say we do things around the medications to ensure that not only are patients on the right medications, but they actually get the right medications into their hands.
Welcome to the CoCoon podcast. My name is Erica, managing partner at CoCoon Ignite Ventures. Together with my two other managing partners at the fund, Theodore and Roland, we invite you to tune in here, where you will find conversations we have with founders and investors on the future and sustainability of work. We have been talking and listening to founders and investors in Silicon Valley, Southeast Asia, Greater Bay Area, and the One Belt region for over a decade. There is so much to learn through venture capital conversations, and we decided to turn these meetings into a podcast to demystify what actually happens on the ground. If you're inspired by these stories and want to work or collaborate with any of our founders or investors, then our call to action is reach out by searching for CoCoon Born to Fly on LinkedIn. We'd love to connect there. Hey, Yoona, welcome.
Thank you for having me.
So I know you got your undergrad in human biology at Stanford, a PhD in pharmacy at UCSF, and a PhD at University of Texas. I think it's all very super consistent from the beginning. So why this field of health? Can we maybe go further back? Maybe to before you went to Stanford. How did you know this was what you wanted to do early on?
Yeah, it's interesting. I don't know if it was my probably my mom's influence. If I go back in time, my mom immigrated here from Korea in the 70s and did her master's in public health here in the States and became a public health nurse. And she worked for LA County as their tuberculosis controller for over 20 years.
Wow.
And so before she was specializing in TB, she used to work down at the LA County clinics, and I would go with her on home visits just to visit her patients. We deliver food to them. Many of them were Latinx immigrants in the LA County area. And then because my mom is an immigrant, she would often have me listen to her cases and or read her cases to give her feedback on the grammar. So I got exposed to medical language at a very, very young age. I think it started.
How old were you then?
I think middle school, around middle school.
That home visits, that's an education. Being on site, meeting people and figuring out and learning about how they are and what treatments they need.
Yeah, and even being in the clinic setting. And so it was, I think that's where I saw my mom's passion for helping people live healthier lives. And I saw the needs out there, especially in the communities that are seeking, public health resources. And it's not just about their health needs, but it's around all their needs surrounding their health. We talk a lot about social determinants of health and structural determinants of health, and things like, ensuring that people have housing and food resources is really important to overall health as well. So I learned a lot about that and kind of whole patient care during those very early days. I never thought I wanted to necessarily become an entrepreneur, but I think my dad's influence came in after he started a couple companies. That's where I got the entrepreneurial side.
So your mom has been a nurse, and your dad's an entrepreneur. Got it.
Yes.
So, what was it like, sort of growing up, having your mom as a nurse? Like, was she on call? Was she on night duty? Like, how does that work?
Yeah, so she was based in the clinics, which are regular hours, and they're public health clinics. So again, the patient population are those who can't afford, who don't have insurance. They come to the public health clinics. So they're mostly immigrants, and it's providing more comprehensive, like ambulatory type of care services within.
Where was this? Was this in California?
This was in LA, Los Angeles County. Yeah.
I see. Okay. And you talked about social determinants. Can you break that down a little bit? Like, you talked a bit about housing and food. What are the other factors?
Yeah, the other factors can be like health literacy, for example,
Mm,
is another example of a social determinant of health, where that often not understanding healthcare could be a
mm,
factor in being able to achieve healthy goals. The other, we talked about housing and food resource, transportation can be a
mm-hmm.
social
That's a
determinant of health.
huge
If you
one.
don't have access to transportation, you often can't seek the proper healthcare. Language barriers, race, ethnicity, these are all considered social determinants of health. And we know that there are differences in health outcomes between those patient populations that have been historically marginalized versus those who haven't. And so that's also considered something that really has a impact on your health outcomes.
Now you were at the public clinic, you were joining mom on her home visits. Do you have some memories of people you met during
Yeah,
those times?
yeah. So because they were mostly immigrant families, we mostly met families who were living in one small apartment with many other families.
I see.
So we would go deliver like food or toys to them during the holiday period. So lots of kids and um they I mean chronic conditions were very prevalent as well, especially conditions like hypertension and diabetes.
Your mother is a complete role model. I mean, to be an immigrant herself, to have been able to get her degree in the US, this was what, in the 1970s,
Yeah, in the
1960s?
1970s. Yeah.
And
Yeah.
not only that, like find a job, but also on her personal time, donate
Yeah.
food and resources to the community of immigrants who may or may not be her ethnicity.
Yeah.
Wow. She is a person with like an immense amount of sort of empathy and generosity. Did she ever tell you like what was it like with her family or your grandparents? Like like what was it like before the US for her?
Yeah, so it's interesting because like so she studied nursing undergrad in Korea. And then
Hmm.
when it came to, and she lost her dad due to cancer. So she was one of the main caretakers helping her dad during his cancer journey. And he passed away when she was in college. I think that motivated her further to be in healthcare. And before he passed away, though, she did make a case to him to study in the US. Like back then, there weren't a lot of females coming to the US alone. But she wanted to come to the US and further her education and go explore the world. So she did make that case to come out and study here.
What a
And then,
character.
yeah, yeah. So she's very adventurous, sympathetic, and wanted to go explore the world a bit.
And is that how she met your father? Like after she got her
Yeah,
degree and started her job out here?
she met him in the US. So my dad was here in the US getting his PhD in physics, and they met in the US, and then got married and had kids, and then ended up staying here to they decided they wanted to raise their kids in the US.
Is your dad from Korea as well?
Yeah, he is. So they both
Wow.
came over in the 70s around the same time and ended up meeting here through a mutual friend.
Destiny. You mentioned a bit about dad being an entrepreneur. So what does dad do?
Yeah, so he has a photodiode company. And so he's always been in the semiconductor world. So he got his PhD in physics and then went to work at Bell Labs. And during that time, I think he developed new types of photodiodes, eventually branched off into starting a company. And then he's on his second company now and still running it at the age of 76. It's used in telecommunications. I am not a physicist, so I can't tell you what exactly it does, but I think that's where probably I got my entrepreneurial side.
Very impressive. I mean, the apple never falls too far from the tree. So,
Yeah.
with two parents who are immigrants and have studied and achieved so much, it's no surprise to me now. Okay, it was a surprise to me when I was reading on your bio that you have two PhDs, but okay, now I'm not. I'm super like, oh, okay, it makes a lot of logical sense. Now, do you remember how we met at Mayfield Cafe in Palo Alto for the first time?
I do,
Like
yes.
4 years ago. So one of my best friends, Ali Sier, who is our venture partner, suggested I meet you during one of our annual Bay Area visits. And I barely knew anything about your field. I venture to say I still don't know enough about your field, but I knew the moment I met you that you're committed to the cause of medication management. You know, that
Mhm.
commitment, I can see it through your family. Like your mom and dad are super committed to whatever they do. So I guess, it makes a lot of sense that they have a daughter who demonstrates that commitment, very early on. And I also knew that given the opportunity to invest in fellow Stanford women, my job was really just to like jump in like quick.
Mhm,
So I brought the
mhm,
deal
mhm.
back to Hong Kong to my two partners, and then the rest is history. I remember I was new to investing and you were new to fundraising. So how hard was it at the beginning to start up Arene?
Yeah, it was, you're right. It's an area of passion of mine, like being a pharmacist, right? I've seen, and even in those early days when I went on home visits with my mom, I saw the problems that can be caused if patients are on the wrong medications. And that was the problem that I wanted to solve with Arene. In the early days, it was extremely difficult to raise capital. That's why I'm very grateful to CoCoon for taking a bet on us. Back
Thank
then,
you.
this was like in 2018, right? 2019, the investment dollars were going toward dispensing and delivery companies like PillPack
Right.
or in medication adherence solutions like glow caps, right? So that patients remember to take their medications. But they weren't going toward what we're working on, which is looking at, is it the right medication to take in the first place? Is it the right medication to dispense? Nobody was tackling what I saw as the core root of the problem,
Right.
just getting the medications right.
Now, can we
So
break that down a little bit? Like, what's happening in medication mismanagement? Like, who is suffering? Who is paying for it? And who is
yeah,
getting paid? Because who's getting paid is sort of the root of the cause. So I'm trying to figure out, like, what does the problem look like?
yeah. So the US did the Scripps Institute did a study here that found that the cost of patients being on the wrong medications was a $530 billion problem. And most
Oh,
of that is in the form of unnecessary, avoidable hospitalizations.
mm,
So, to give you a very concrete example, if a patient isn't, escalated on the right drugs for their chronic condition, right, they could end back end up in the hospital because of complications. Diabetes is a perfect example of that. If you're not on the right medications to get your blood sugar controlled, that can lead to both microvascular, macrovascular complications like different infections or even things like foot amputations and other like organ failures, etc. So can lead
so
to
the
some
domino
pretty
effect of Medicaid, if
the
if
domino
I'm not
effect.
getting the right meds, the domino
Yeah,
effect basically gets me hospitalized.
yeah, that's right,
Got it.
right.
Okay.
And we see all sorts of problems from the example I gave is patients not being escalated appropriately on therapy to get like their clinical goals achieved. Other examples could be maybe there's a untreated condition where the patient's having shortness of breath but isn't prescribed the appropriate inhaler therapy. It could be being on the wrong dose. Maybe you're not on a high enough dose to have a therapeutic effect.
Mm,
And lastly, it could be things like drug interactions. A doctor
mm.
adds a drug not knowing what another doctor is prescribing, and that leads to side effects that could in turn lead to serious consequences, like ending up in the hospital.
On that note of dose, medication, the specific medication, and also drug interaction. Are these some of the factors that you've built into Arine's AI algorithm to
Yeah,
enable clinics to prescribe a more accurate medication or
that's
dosage?
yeah. So the users of our platform are like the nurses and the pharmacists. They
Okay.
see those medication recommendations in our platform, and then they could generate the recommendation then to send to the doctor automatically from our platform, like a note to the doctor that says change, this drug from drug A to drug B to better control this patient's diabetes. So generally, the payers of our platform are like the health plans, because the health plans are the ones that are paying for all the additional hospitalizations and other
Mhm.
consequences of patients being on the wrong medication. So they are our paying customer. Generally, it's the population health care teams of that health plan or their extended care team providers. And usually that team is composed of care managers, nurses, pharmacists that are the users of our platform. And our platform will generate a patient-facing education template. And then if there's a need of prescribing change, a prescriber-facing recommendation that we can send to the doctor directly from our platform.
Wow, that's very impressive. I mean, both you basically need the patient and the prescriber to be on the same page for you to be able to
That's
make
right.
the
Yeah.
intervention. Um, could you talk a little bit about like how these information systems interact? Because like from my limited experience, I think clinics, hospitals, they all have different systems. Like
Mhm.
how are you able to bring Arene to all these different stakeholders at the same time be able to take in the data, sort of the patient
Yeah.
longitudinal data, so you can train your AI, at the same time be able to send the data or recommendations back to them to their systems?
Yeah, so we are mostly contracting with health plans. And so health plans, what they have access to is everything that they paid for, all the healthcare services that patient has received. So that includes like all office visits, all hospitalizations, including the diagnoses associated with them. On the medication side, we see every medication that was picked up from the pharmacy, who prescribed those medications. Essentially we see like the full picture of care of what this
Mhm.
patient is receiving from different hospitals. Since from that data, we can tell like who is their cardiologist, who is their endocrinologist. If our platform generates like a diabetes recommendation, we know that that needs to be sent to that patient's endocrinologist. If the platform generates a cholesterol related recommendation, we know that that needs to be sent to the cardiologist that we see in the data. So we're really using the data that we get from health plans to put together and have a very good understanding of the clinical risks, the medications that have been tried and failed, who are the physicians that this patient is seeing, and how often are they receiving care, and also the patient's demographics as well.
See, a lot of investors get the opportunity to invest in X Facebook and X Google or X Alibaba, X Tencent. But I remember when I first met you, you have this like wealth of knowledge about the healthcare system because you already had like a decade of,
Mhm.
working at Proteus and Novartis under your belt. Can you talk a bit about that, I think, for other founders in terms of like industry knowledge? How did you gather your industry knowledge and how did you use it as you were building your startup?
Yeah. So I think there's two types of founders that I've seen. One is like the really young, bullish, very brave founder that just jumps into a new industry. I did come at it from a different angle. I came at it after 20 years of being in the healthcare industry. And so I see Arene as like a culmination of all my prior healthcare experiences. And I've worked in a variety of settings. I've worked doing payer consulting and actuarial work. I've been in the pharma industry. I've been on the health plan side for a little bit. I've been at other digital health companies. the underlying theme of all of these work experiences has been in every job, I follow the money in healthcare and I've evaluated outcomes. So Arine was because after my 20 years of doing that, I realized that getting the medications right is one of the largest levers that we can pull to impact cost and quality outcomes in healthcare. And I saw that in all the evaluations that I was doing.
When you had to leave the large organizations that you worked at to become a startup founder, what was that trigger? When did the moment arrive for you? Like you said, in 2018, 19, everybody was backing the likes of PillPack. Why did you want to break into this very hard AI field and get into the medical systems to work on medication management?
So I mean, it was because I definitely had a passion for the need that was out there and the fact that nobody was solving this problem. I did feel like, one of my prior experiences before starting Arine was a later stage startup company. That was the first startup company that I went to. And I got to learn multiple aspects of the business that way. I interacted with investors and the board members. I ran the clinical team. I participated in like partnership discussions. So that really allowed me, I worked closely with the product team on launching new product features. So that really allowed me to see kind of like the different aspects of running a startup. And I think that's what gave me more confidence in starting my own. I did not have ambitions to start my own company previously. It was just one of those moments where I felt like, okay, I think there's a better way to solve this problem. I think now I've garnered enough experience to make me feel like, okay, I can make this happen. And it was the third thing was finding the right people to do this with. Our CTO is someone that I worked with at the prior company I was at. So we were working closely together. We've been now working together for over 10 years. She's fantastic and really has the same DNA as I do to kind of the perseverance to make it work. So finding the right partner also gave me the motivation to finally make the jump and take this step.
Having the innovation in your mind and having the people who can execute it with you.
Right.
I see.
Right.
Okay, let's talk about people, because the last time I visited your office in San Francisco, you had 6 people there. How is your team coming along? It's been 3 years and I know you guys have gone distributed and hybrid. How has the team grown over the years?
So now we have around 100 FTEs.
Wow.
So the team has grown quite a bit since those days. And we grew really quickly. So I think you came and visited us probably 2019, 2020.
Yes.
2019 probably is when you came.
Yes.
And fast forward to 2022, now we're at 100 people. So we've expanded the team quite rapidly. Now there are 6 people just on my leadership team. I think we've hired some great people over the years. We are in a hybrid work environment, so we have people working across many different states. And one thing that we've done, though, in order to work better together in this hybrid environment, we do bring teams on site on a quarterly basis. The engineering team was just on site. The clinical operations team was just on site. So we rotate through our San Francisco health headquarters and bring teams on so that people can meet each other, build camaraderie, work together in person. The other thing is that our office is open and we all go in several days a week now. We try to offer lunch to those who will come in. Yeah. And a lot of my key leadership roles, the folks that I have to work very closely with, like our head of product, our CTO, our CFO, they're actually all on site in San Francisco, our head of strategy. So I think that hybrid work environment can work, but you have to make very much a concerted effort to make it work. Yeah.
Absolutely. The dedication of showing up and bringing our energy together. I feel like human beings have energy and I cannot get that through like a video conference call.
Yes, that's right.
And once you bring that energy together, new things happen, new things spark. So what were some of like the sort of growing pains of going from, let's say, 10 to like 30, and then maybe 30 to like 80? Like, how did you get past some of those hurdles of every stage of acceleration?
Yeah. So, I mean, I think going from 10 to 30, like the growing plane there is probably just getting enough product market fit and getting your growth going, right? Getting
Yes.
your first customers on board, launching them successfully. Growing from 30 to 80, I think we've had to, and even now, so we're still very much going through the growing pains. We've had to, now we know we have product market fit. We know we have customers that want to buy us, and we're still working on creating a sales machinery around that.
Mhm.
But we're also working on, and where a lot of the growing pains are coming from, is just putting like business infrastructure, operational infrastructure into place, so that we have an implementation team function. We have a product function that works, hand in hand with engineering, and we have a way to vet customer requests. So just now we have a way to handle, performance reviews for the company. So all the things that we need to put in place to manage now 100 employees, we are in the midst of putting into place now.
You talked about sales machinery. So I want to congratulate you on partnering with Priority Health. I know they're your
Oh, thank you.
most recent new client. And I
Yeah.
read in this article where they said Arine makes multidimensional data actionable, pinpointing the safest and most effective medication regimens for each patient based on their individual needs. It's one sentence, but it's a lot of work that you guys are doing. And you're
Yeah.
in a very complex field of B2B technology. Now, B2B, selling B2B, like you said, in the sales machinery, is hard even for easy products. And,
Mhm.
and I think what you're doing at Arena is complex. So how do you go about curating, developing, and closing potential customers at Arena? How does the B2B sales machinery work?
Yeah. So, healthcare, selling to large healthcare insurers is not an easy task by any means. So initially what we did is we used a lot of our Rolodex and contacts. Like I said, I've been in healthcare for a long time. Same with our chief growth officer and a lot of the folks on our sales team. We tap
Mhm.
into our advisor network to get those connections. Now, a lot of our new clients actually come from current client referrals. So we've had zero churn. Our current clients are making those referrals on our behalf and saying, hey, you have to start working with Arine. So to me, everything starts with actually delivering outcomes to the clients. And then from there, that's when you start to get new leads from your existing clients. We are doing other things, like we're creating a business development function where we are now having folks reach out cold calling to new prospective customers. And we've developed things like messaging by persona, right? So if it's the chief pharmacy officer versus the head of quality, what should that messaging be? We've developed a sales playbook so that our sales team, when they come on board, again, they know which products we're selling to whom, what's our value proposition that we're offering, what's the differentiation of our product. So all of that sales enablement, sales messaging is being honed and being developed.
And I think that really demystifies how startups really get to product market fit. There is no easy way at the beginning. You
There's
just have
no
to
easy way.
call everybody in your
Oh, yeah.
Rolodex or your Excel spreadsheet and like combine all your Excel
Yeah.
spreadsheets until you get your first customers. And I really liked what you said about, at the end of the day, it's about delivering outcomes, because when you have outcomes, your customers will refer their
Yeah.
friends.
Yeah.
And then once you get that momentum there, then you can build out the business development wing
Yeah.
of the business. I read in another article that Arene makes equitable and affordable healthcare available to customers like Blue Shield of California members. You mentioned earlier when we were talking about mom, how you've been doing home visits and working with immigrants, since middle school. Given your experience now, can you talk a bit about equity and affordability? What does the gap look like? How big is that gap, and how are you closing it?
Yeah, so we talked a little bit about the social determinants of health and earlier in conversation, and we as you know we have our own clinical call center as well for those health plans who need our supplemental help via our clinicians. So we also have a team of folks making those calls directly to patients and
I see.
providers, educating them. Through that vehicle, we've also learned quite a lot. And one of the things that we learned is that a patient's priorities don't necessarily align with our priorities. Like if a patient doesn't have access to food, they're obviously not going to take their medications. They have other
Right.
priorities, right?
Yes.
So it's bringing, I think, what we try to do at Arine is look at also the social behavioral picture as well as the clinical picture. And then work with the health plans on identifying these needs. And so for instance, during COVID, food resources, a lot of folks struggled with that and finding food resources during that time. So one of our health plans was offering some a program around getting access to food, working with like the local markets and such. So we built in a algorithm that identified those who needed these food resources, and it went into our patient-facing care plan so that they know how to access this resource. So by again closing that gap, then we can finally talk to them about their medications. Another example is we often identify patients who have transportation barriers. Every health plan actually in the US offers some sort of transportation benefit. Most of them do, or their clinics do. So getting them, making them aware of these types of transportation programs so that they could actually get to the doctor's office or go to the pharmacy to pick up their medications.
It sounds like you guys are not only, the best AI platform for medication management, but you're working on something even bigger. Like you're working on the
Right.
whole person, like health, care, and wellness.
Yeah. So I often say we do things around the medications to ensure that not only are patients on the right medications, but they actually get the right medications into their hands.
Now, my children, I want to loop back to this, but a little bit about the show Shark Tank. I watch Shark Tank with my children, and so they're big fans of Mark Cuban. And I was recently listening to Adam Grant's podcast, and my daughter was nearby, and so she was like, "Oh, I want to listen to the Mark Cuban episode." And in that episode, Mark Cuban talks about cost plus drugs, where they're selling like 15,000 generic drug medications. And of course, there's like Amazon Pharmacy, which, like you said earlier, was PillPack, which Amazon acquired in 2018 at $750 million US dollars. Now, what do you think about these dispensary platforms, and how do they work, with your ecosystem? And, these are the consumer facing platforms, but how do they work with the likes of like Priority Health or Blue Cross Blue Shield, Medicare, Medicaid?
Yeah. So Arine will incorporate recommendations around where lower cost options that are therapeutically equivalent, or making the patient aware that they can get these lower cost medications at different resources, whether that's Mark Cuban or other places. Oftentimes, like these, like Mark Cuban's pharmacy, I believe, is a cash pay pharmacy, and they don't take a lot of insurance. But it is very good for the underinsured or the uninsured member population. And if any of our patients that we're serving, even through the health plans, say they can't get access to a certain medication through their health plan, then we might refer them to other resources where they can pay cash pay and find a low cash pay option like Mark Cuban's pharmacy. So I think it's a wonderful option for particularly those who are uninsured. And I know he's been talking about getting more of the branded medications on board. Right now, he is mostly dispensing generics, which are lower cost, but he's making them even more low cost, which is great. I think the real game changer will come when he also dispenses branded drugs at much lower cost, because those are the drugs that can cost thousands of dollars out of pocket for a patient.
Got it. So there is the medication management, there is the sort of social behavioral kind of awareness, like how can I get access to food? How can I get access to a bus so I can actually go to a clinic where I can pay cash to get a generic or perhaps a branded but lower cost medication that I need. Okay, got it. So, you know, what I'm hearing is go like what you've been doing all along, even when you were in middle school, you are actively closing the gap of, you know, how do I take care of my health when I cannot afford to? What is the size of this market? Like you talked about $500 billion in terms of like hospitalization, but what is the size of the market of folks in America who don't have access to the healthcare that they should
Yeah,
have?
I mean, that's even bigger than the $530 billion problem. $530 billion problem is the problem of patients being on the wrong medications. But if you look at the potentially like underinsured or uninsured population that doesn't have access to care, I mean, those numbers I know can get very large. I don't know the number offhand, but it's a huge problem.
It's a human problem. You know, it's not
Yeah.
a venture capital problem. It's not a startup problem. It's a human problem, and I'm so excited to hear that you're solving for it. And you know, people talk about sustainability. They talk about climate change. And I'm personally very you know, fascinated by work, having everybody having access to work, and you know what you're offering them is access to quality health. And I also want to congratulate you. I know that this year you just raised $29 million in Series B, led by 111 West Capital, MBX Capital, and New Leaf Ventures and Catalyst Ventures. So, what has it been like fundraising at each juncture, like from seed to Series A to Series B? I think a lot of women founders would be curious to know what are the hurdles and how did you get past them?
Yeah, so the seed stage by far was the hardest because again, this idea that I had for Arine was a novel idea and something that people weren't paying attention to. And the investors didn't have visibility that the medications and getting them right was actually a problem area. So that was very challenging. At Series A, we did have some proof points, and then in terms of patient outcomes, so it was easier then, and we had some early customer traction as well. Series B, even though we were fundraising as the market was crashing, it was much even easier because then we started to show the market traction with customers and outcomes at greater scale. So with each round, I'm hopeful because it's getting easier with each round. But I will tell you, during the seed round, I probably talked to over 50 investors. I had so many conversations. Back then, to get any money in the door was a huge challenge, which is why I'm so grateful for, CoCoon for giving us a chance back in those early days.
Thank you for giving us a chance. This is super counterintuitive, right? Like most founders think that the more money you have to raise, the harder it gets. But it's not true. It's about knowing your stuff and getting it on the ground and delivering outcomes. And then venture capital needs to follow the founder. It's rarely founders chasing money. It's always money chasing founders. And you've achieved that state. So congratulations.
Thank you. Thank you.
Now, I love this commitment that I read on your website, which writes, we help patients stay well so they can spend time with loved ones, so they can go to school, so they can do yoga, so they can babysit their grandkids. instead of worry about their medication. So my final question for you today is, if you're right, what would the world look like in the future?
Yeah, so I am a believer that anybody on like medications are like a large source of anxiety for patients, and it can cause a lot of confusion as well. So anybody who's on more than one medication should have access to something like Arine, right? To tell them, hey, these are the medications you're taking. This is what they're for. These are the best options for you that will help you achieve your goals of therapy. And we also need a better understanding out there of how these medications are working in the real world, in which patient populations benefit the most out of them. So as we gather more data from the populations that we're serving today, I want to continue to hone our medication, what we call medication intelligence, which is in which populations is it the right drug and the right dose, and who needs that medication change, and make this scalable enough that it's and accessible enough that it's available to everyone with multiple medications.
What you're doing makes the world better, and I'm sure makes your mother immensely proud.
Oh,
So
thank you.
thank you so much, Yoona. Thank you so much for your time today.
Okay, thank you, Erica. Thank you.
Hey, thank you for listening today. If you like what you heard, don't forget to subscribe to hear more from entrepreneurs and investors on why they got started, how they got through the hard parts, and what they'll be doing next. If you're inspired by these stories and want to work or collaborate with any of our founders or investors, reach out by searching for CoCoon Born to Fly on LinkedIn. We'd love to connect there. Download more episodes or subscribe via Spotify or YouTube.